In 2008, I was diagnosed with Graves' disease, and in addition to restoring my health, I have also helped many others with this condition avoid radioactive iodine and thyroid surgery. In this video, I'll discuss some of the things I did to restore my health, how I have maintained a state of wellness over the years, as well as what I've done to help many others with Graves' disease save their thyroid and regain their health. And this information will help you regardless of whether you are recently diagnosed with Graves' disease or if you've been dealing with this condition for many years. And in case if you don't know who I am, my name is Dr. Eric Osansky. And in addition to being a doctor of chiropractic, I also have a master's degree in nutrition, and I'm also certified through the Institute for Functional Medicine. And since being in remission, I also have written a couple of books on hyperthyroidism, as well as one on Hashimoto's. I also have a well known website where I have hundreds of thyroid related articles and blog posts. And I also have a podcast called Save My Thyroid that has a lot of episodes that focus on hyperthyroidism. So let's go ahead and start off by discussing what is Graves' disease. So, Graves' disease is actually more of an immune system condition than a thyroid condition. So, with Graves' disease, the immune system attacks the TSH receptors of the thyroid, and this results in a state of hyperthyroidism. So, on a blood test, you will see T3 and T4 elevated. Typically, you will. Every now and then, there'll be someone who has subclinical Graves' disease where T3 and T4 are looking good. Either way, TSH, which is thyroid stimulating hormone, will often show up on a blood test as being not only depressed, but undetectable. And the reason for this is because TSH, it's actually a pituitary hormone and it communicates with the thyroid gland. So, in the case of hypothyroidism, so if someone has low thyroid hormone, the pituitary will release a good amount of TSH. So you might see TSH as being elevated on a blood test in the case of low thyroid, hypothyroidism. And that's because it wants the thyroid gland to produce more thyroid hormone. But with hyperthyroidism, of course, this is the opposite. You don't want to have an increase in thyroid hormone. You want the thyroid hormone levels to decrease. And so this, as a result, you'll see very low levels or undetectable levels of TSH. So again, low TSH or undetectable TSH, elevated T3, T4 in the blood test, and then you'll also have elevated thyroid stimulating immunoglobulins or TSI, and these are the antibodies associated with Graves' disease. Also worth mentioning that this is a type of TSH receptor antibody. So you also might see on a blood test TRAB. So you might see TRAB and or TSI depending on what your doctor orders for you. And should also mention other blood test markers might be affected. Some people with hyperthyroidism will have elevated liver enzymes, so AST, ALT. Many times they look normal, although if they take antithyroid medication such as methimazole or PTU, that could affect the liver enzymes, cause them to be elevated. Low creatinine, so on a comprehensive metabolic panel, if you see low creatinine, that typically relates to low muscle mass, which is very common with hyperthyroidism. And then alkaline phosphatase is commonly elevated in those who have hyperthyroidism. And some, when they look at that on a blood test, are concerned about the liver. But usually, when you see alkaline phosphatase elevated, it's more related to the bone turnover. You get a lot of bone turnover with hyperthyroidism. So that's usually why you see that elevated alkaline phosphatase. And the good news is, as the thyroid hormone levels normalize, typically the alkaline phosphatase will decrease, but it could take some time. So if you have a normal thyroid hormone, if you have a normal thyroid panel where thyroid hormone is normal, and let's say even TSH is normal, alkaline phosphatase might stay a little bit elevated for maybe even a few months. So you want to definitely keep an eye on that, but over time you should see the alkaline phosphatase decrease. So, what are some of the common symptoms associated with Graves' disease? Well, let's talk about some of my symptoms. My symptoms when I dealt with Graves, I definitely had an elevated resting heart rate, and I'll talk more about my story in just a minute. But I had elevated resting heart rate, I had palpitations, I had tremors, although not everybody with hyperthyroidism, not everybody with Graves' disease experiences weight loss. I did lose a lot of weight. I lost 42 pounds, had an increased appetite. I had some loose stools at times. And yeah, though there could be other symptoms. Some people experience hair loss. Some people experience anxiety is pretty common. Insomnia is common. A number of people have what's called thyroid eye disease or Graves ophthalmopathy, where they have uh, bulging of the eyes or pain, swelling, sometimes double vision. Most of the time, it's on the mild side, but there are times when it could be moderate to severe. And so those are some of the more common signs and symptoms. And then when it comes to treatment options, typically there are three treatment options that most endocrinologists will give. One is antithyroid medication and beta blockers. So antithyroid medication includes methimazole or propylthiouracil, also known as PTU. Usually they give methimazole. If someone is unable to tolerate the methimazole, then they might take the PTU. Or if it's a woman who's in the first trimester of pregnancy, then usually they'll be put on PTU in that first trimester. Beta blockers sometimes are given, such as propranolol, and propranolol commonly given because it not only will help with the elevated resting heart rate, but also it inhibits the conversion of T4 to T3. Other beta blockers sometimes are given, such as atenolol, metoprolol. And so option number two, given by most endocrinologists, radioactive iodine, which ablates the thyroid gland. And in theory, it might sound good to some people. The problem is that it's not doing anything to address the cause of the problem. And of course, neither is the medication, but you could take the medication and still preserve the health of your thyroid gland, but that's not the case with radioactive iodine. I mean, there are people who get radioactive iodine and the dose isn't high enough, so they might need multiple treatments. So it's not like everybody who gets it will become hypothyroid, but that's typically what happens. Or again, if one treatment doesn't do it, then they might get another dose of radioactive iodine. But essentially, most people who receive radioactive iodine ends up on thyroid hormone replacement. And again, you're not doing anything for the autoimmune component of Graves' disease. And if you have one autoimmune condition, you're at a greater risk of developing other autoimmune conditions in the future. And then the third treatment option given by endocrinologists for those with Graves' disease is is thyroid surgery, a complete thyroidectomy. Which again, there's a time and place for thyroid surgery. I'm not saying there's never a time and place for thyroid surgery, but it should be a last resort, because once you get the thyroid gland removed, there's no turning back, and you definitely will need to take thyroid hormone replacement on a permanent basis. And then once again, you're not doing anything to address the autoimmune component. So even if you were to receive radioactive iodine or thyroid surgery, you still would want to do things to improve your immune system health to decrease the risk of developing other autoimmune conditions in the future. And then family history of Graves' disease. So there is a genetic component really with any autoimmune condition. There's what's called the triad of autoimmunity, also known as the three-legged stool of autoimmunity. And with this triad, there is a genetic predisposition, also exposure to one or more environmental triggers, and then an increase in intestinal permeability, which is the medical term for a leaky gut. Now, not everybody seems to have a strong family history of Graves' disease. So when I dealt with Graves, there was and even up until this time, there's nobody I know in my family who had Graves' disease. And when I work with patients, I get mixed. I mean, some people will have a strong family history. They might have a parent or a sibling with Graves, and then there are other like me that they don't have any history of Graves' disease. Sometimes I'll have a history of another autoimmune condition like Hashimoto's in the family, or non-autoimmune thyroid condition. But again, it does depend on the person. So getting back to my story, how did I find out that I had hyperthyroidism? So what happened is I was in late 2007, I was a little bit overweight for what I considered my a healthy weight. I usually like to be between like 165, 170, and at the time I was 182, which is the most that I've been. And so I started to diet and detox and was exercising pretty hard, doing things to lose weight. And over time, I was losing weight. Little did I know that over time it was more related to the hyperthyroidism than actually the dieting and exercising. But what happened is one day a few months later, this was in 2008 now, I was walking around in a retail store at a Sam's Club. For anyone who might be overseas, you might not have a Sam's Club there. So Sam's Club, big retail store, they had an automated blood pressure machine, and I went to take my blood pressure, and my blood pressure was fine, but my resting heart rate was elevated. At the time was 90 beats per minute, which for me was high, and for pretty much most people it's high. You don't want a resting heart rate. Really, ideally, you want it like in the lower 70s at the highest, and lower than that is even better. But it was 90 beats per minute, and then I took my resting heart rate the next few days at home, and it was anywhere between 90 and 110 beats per minute. And so eventually I went to a primary care doctor, got some blood tests, and yeah, and even before that I started putting the pieces together a little bit. I wasn't definitely wasn't experienced like I am now with hyperthyroidism. I was my pretty much my first patient, but just losing weight, losing a lot of weight, and increased appetite. Again, I did attribute that to the diet and exercise, but then when I saw the elevated resting heart rate, I knew something was up. So again, went to a primary care doctor, after some blood testing showed that had elevated T. Well, I don't remember if they did T3, but they probably just did a T4 and TSH. But either way, I was diagnosed with hyperthyroidism, and then eventually went to an endocrinologist who did some additional testing, including the Graves' disease antibodies, which were positive, and so I was diagnosed with Graves' disease. And again, this was in 2008 when this happened, as far as the official diagnosis. And I mentioned the experience, the symptoms that I was experiencing. And as far as the approach I took, so again, I've been in remission since 2009, and but I did a lot of things naturally. I mean, pretty much I did everything naturally. Not to say that there's not a time and place for antithyroid medication. I work with a lot of people who take the methimazole. Some people take the beta blockers, but I guess because of my background, what would happen is, as a chiropractor, we need to take continuing education credits. And when I took my continuing education credits, it would always be in nutrition. It wouldn't be chiropractic. Like a lot of chiropractors take adjusting CE credits. And so me, it was always nutrition. I just had a passion for nutrition, even though up until that point, I didn't utilize it much in my practice. But I did attend a few functional endocrinology seminars, and that's where I learned about natural approaches to thyroid. So this was prior to my Graves' disease diagnosis. So when I was diagnosed with hyperthyroidism and eventually Graves' disease, I knew I was going to give the natural treatment approach a try. Now, I had no idea if it would work because, again, I didn't have any experience working with other people who had hyperthyroidism, Graves' disease. So one of the natural agents I took to help manage my symptoms was an herb called bugleweed, which is an anti-thyroid herb, helps to lower the thyroid hormones. And so I took that. And again, I was open to taking the anti-thyroid medication, but I figured, hey, let's just give it a try. The bugleweed. I took the bugleweed, and I did notice a decrease in my resting heart rate, which I continued to monitor. I was still having some palpitations, and so I added another herb that I learned about when I took my CE credits, the functional endocrinology seminar, and that herb was motherwort. So I took bugleweed and motherwort for quite a while, for about 9 months. And so I haven't taken either one since then. It's been many years since I took those, but I was on both of those for quite a while I was trying to improve my health, trying to restore my health. And like I said, you want to be safe. Not everybody can manage their symptoms effectively with the herbs. And there are other natural agents. There's lemon balm is commonly taken by those with hyperthyroidism, kind of have has a calming effect. At the time, I wasn't as familiar with lemon balm. And then L-carnitine in higher doses, the research shows between 2,000 and 4,000 milligrams per day can block the entry of thyroid hormone into the cell. Again, I did not personally take L-carnitine because I wasn't aware of the benefits it has. And to be fair, it's not like I have all my patients who want to manage their symptoms naturally take all of these. It's not like everybody who refuses to take the methimazole will take bugleweed, motherwort, lemon balm, and L-carnitine. I mean, some people will choose to do that, but not everybody needs to do that. But as I said, there is a time and place for the antithyroid medication. If someone is already taking, let's say, methimazole, and they're tolerating it well, and I mean, it usually does a really good job of managing the symptoms. So if they're not really having side effects, then I think it's okay for them to continue with that. I mean, if they want to take more of a natural approach as far as symptom management. Again, I emphasize symptom management because the bugleweed and motherwort, they're not doing anything to address the cause of the problem, just like the methimazole isn't. But if someone sees me and they want to make that transition, I can't tell them to stop taking the antithyroid medication, but I could recommend some bugleweed and or L-carnitine, and then they can monitor their blood tests. And then if they start getting on the hypo side, that will indicate they need less of the antithyroid medication, and the prescribing doctor can decrease the dose. So again, there are some people that choose to take the bugleweed and or L-carnitine at the same time as methimazole. Usually, I recommend spacing it out and not take it exactly at the same time. But again, there are people who just take the methimazole while addressing the cause of the problem. So I did want to mention that. And then diet. So a lot of people have a question about the diet. So these days, I do like the Autoimmune Protocol, like an AIP diet to my for my patients with Graves' disease. It's not a perfect diet. There's no single diet that fits everyone perfectly. There are some people that just follow a regular paleo diet and they do okay. I mean, the more food you introduce, that I mean, you definitely want to avoid the inflammatory foods, refined foods, and sugars, and focus on whole foods. But I try to be more on the strict side. I mean, nobody wants to follow a restrictive diet. And so ultimately, it's up to the person. If someone feels that the AIP diet is too stressful, then let's go with a regular paleo diet. If they feel that that's too restricted, maybe they're eating fast food every day and eating a lot of refined foods and sugar. So maybe they start off with a modified paleo diet, or just focusing on gluten free and eating whole healthy foods. So everybody's different. Now, when I dealt with Graves' disease, there wasn't an AIP diet. Again, this was back in 2008 that I was diagnosed with Graves, and there wasn't, as far as I know, there was an AIP diet. There were similar diets, so like gut healing diets, and so I followed more of a regular paleo diet initially, just because again I didn't know any better, and there was an AIP diet then. So, and overall, I did pretty good. I did hit a roadblock in my recovery, and I should say I wasn't a big egg eater, but I did eat a lot of nuts and seeds. And so, when I hit that roadblock, I decided to cut out the nuts and seeds for a couple of months, and then I started making progress again. And so, it might have been coincidence, but I think the nuts and seeds might have held me back. So, I essentially was following kind of like an AIP diet for a few months, not knowing that it was an AIP diet, like it wasn't called, it wasn't AIP, like I said back then. But yeah, anyway, it's ultimately up to you. There are some people that do okay with regular paleo diet. The thing is, if someone's following, let's say, a regular paleo diet and they hit a roadblock like I did, that's the first place I'll look. It doesn't mean that it's related to the food, the roadblock, but rather than spend tons of money on testing, I might say, well, okay, maybe if you've been eating eggs on a regular basis, why don't you take a break from eggs and see how you progress? Or again, the nuts and seeds, or if they're eating nightshades. So that's why really I try to be more restrictive initially, just because those who are work with me, they're obviously spending money to get better as quick as they can. And so ultimately it's up to them what they want to do with the diet. But I definitely recommend to follow either an AIP like diet or a regular paleo diet. Stress. So, what impact did stress have on my condition? So, stress was big. Now, I was in denial at first because I knew that stress was a factor, but I thought I did a good job of managing the stress. And I ended up doing an adrenal saliva test, and everything was low. Cortisol was low, DHA was low. There was a marker called secretory IgA, which was low. And that was the marker actually that did not improve. After 3 months, I retested adrenals after blocking out time for stress management, and just overall improving my stress handling skills. And again, the cortisol that was low improved, the DHEA improved, the secretory IgA did not improve, and that's when I cut out the nuts and seeds. Eventually did a retest just of the secretory IgA, which did improve. I should also mention that I was overtraining. Again, I didn't realize I was overtraining, but looking back, I was over exercising too when I was trying to lose weight. And so that was a stressor on my adrenals as well. And I find in my practice, stress is huge with most of my patients who have Graves' disease. Many will openly admit when filling out the health history that stress is a factor. Others might not make as big of a deal out of it, but then when we're having our initial consultation, we'll realize that stress was a factor. Maybe it's not a factor or wasn't a factor when they were filling out the form, but it depends. Like I work with people who were diagnosed recently with Graves, but then I also work with some people who have been dealing with Graves for a few years. So maybe they were dealing with Graves for a couple of years or 5 years or longer. I mean, everybody's different. And then at the time of filling out the forms, the stress was better. But at the time that they were diagnosed with Graves, the stress was really high. So again, everybody is in a different situation. And then testing. So what testing do I like to do? So I mentioned I did. I had an adrenal saliva test. I also did blood testing. I mean, the truth is, I'm more conservative when it comes to testing just because I was conservative when I dealt with Graves. But once again, everybody is different. Some people do need to be more aggressive when it comes to the testing. Some people need to do a comprehensive stool panel. I don't think everybody does, but I think, again, some people definitely do. Organic acids testing. I mean, food sensitivity testing. I can't say I love that food sensitivity testing just because there are definitely flaws, but then again, there are flaws with the elimination diet as well. So there is a time and place for food sensitivity testing. I don't recommend it to most people, but if someone's hitting a roadblock, that might be a time when I'll look into it, or I might look into another test. And a lot of it depends on the health history. If someone's having a lot of gut issues and it doesn't seem to be resolved by food, then yeah, I will recommend some type of gut test, whether it's a comprehensive stool panel, or maybe if they're experiencing a lot of bloating and gas with certain types of food. Maybe we look into SIBO, small intestinal bacterial overgrowth. So it really depends on the person. And the same goes with supplements. So with supplements, there are definitely basic, like general supplements I recommend for most people. So well, I mentioned the herbs like bugleweed, motherwort. I mean, that if someone, like I said, if someone's taking the antithyroid medication, they're happy taking that and they're not having side effects, that's fine. So I can't say I recommend those to everybody, but I recommend an omega-3 fatty acid to most people. Some people are concerned about iodine in fish oils, and I'll talk a little bit more about iodine shortly, but I find most people do okay with a fish oil. If someone's really concerned, I mean, again, if you're not taking a fish oil and you're not eating enough fish per week, so if someone's eating fish 2 or 3 times per week, and again, fish does have iodine, but most of the time, depending on what type of fish someone's eating, if someone's eating wild salmon, for example, that doesn't have a lot of iodine, maybe like 30, 40 micrograms per serving. If someone's eating cod, that is higher. If someone's eating shellfish, that's going to be high, like lobster, oysters. And again, it's not that people can't tolerate that. And there's a lot of controversy with iodine. So I said I was going to get into iodine later, but I guess I'm getting into it now. It's just because, again, there are concerns with iodine. So I'm not recommending separate iodine supplements, but I'm just talking about fish oil because someone's concerned. So I'll talk more about iodine in a couple of minutes. But so as far as general supplements, so again, an omega-3 fatty acid, probiotic. Now, again, you could try to eat plenty of fermented foods like sauerkraut. Problem is, most people aren't eating them daily, and most are just sticking with the same fermented foods. Like they might eat sauerkraut every single day, but you want the variety. So I've been taking a probiotic supplement for a long time, recommended to my patients. I'll test for vitamin D on everybody, and a lot of people are deficient. So a lot of people end up taking vitamin D. And then it really depends on the testing. I mean, selenium is something people commonly take, but that's why we do testing. I do like supplements, but my goal isn't to recommend like just off the bat 10, 15, 20 supplements just for the sake of recommending. I mean, a lot of people, when they work with me, they're already taking that many. And so it's the opposite problem. It's like, okay, maybe you don't need to take all those supplements. So I like supplements, but you don't want to overdo it with supplements. And so that's where the testing comes into play. And so, yeah, definitely a time and place for supplements. Like, for example, when I did adrenal saliva test and everything was low, I took licorice root, which extends the life of cortisol. Now, if someone has high blood pressure, you probably don't want to take licorice root. Or if you have high cortisol, which is another reason to consider testing the adrenals, again, you probably won't want to take licorice root. So I took licorice root, I took a B complex. And I mean, I took other supplements as well. I can't say I remember all of them since it's been quite a while. But like I said, that's what testing is for. If someone does a gut test and let's say they have parasites, then again, I'll recommend usually an herbal protocol, herbal antimicrobials for that. And so, but I mean, there are some people that just will treat everybody for parasites, but that doesn't describe me. And then, so you might also wonder, how have I maintained a state of wellness over the years? Because I've been in remission since 2009. Now, again, I've had scares. I've had health scares. I had shingles in 2016. I had chronic Lyme disease in 2018, and I thought I was going to relapse then, but thankfully I didn't. And then I got hit hard with COVID in January of 2022, which again, I rarely get sick. When I get sick, it's usually mild, never get the flu, knock on wood, but that actually hit me hard and it felt like I relapsed, which when you have a virus, it's hard to tell. But I definitely had tachycardia, increased resting heart rate. But then when I did a blood test about a month after my recovery, everything looked good. So, so I don't. I think I was fine because it was if it Graves relapsed, it wouldn't be elevated for a month and then just go away. And so I did have some other markers like HSCRP, which is an inflammatory marker that was high when I did that test and that eventually normalized. But so not everything was perfect when I was dealing with COVID and did my first blood test. But again, the thyroid, thankfully, has remains in a state of wellness and my immune system because again Graves' or immune system and so that's been the focus. I definitely have not been perfect and I say that intentionally because I don't want you to think that you need to be perfect not only while restoring your health but while maintaining a state of wellness. Now arguably while healing you want to be more strict than when in a state of wellness. I definitely indulge every now and then. I kid around sometimes that when I have pizza, which I do eat pizza every now and then, I'll have a cauliflower crust pizza, but it won't be the vegan cheese. It will be the mozzarella cheese. So I can't say I'm 100% dairy free. But most of the time, I'm eating pretty well. Again, not perfect, but most of the time, stress management definitely a lot better. Make sure I get sufficient sleep most of the time. I do things for detoxification, like infrared sauna 3 times a week. Now, again, if someone's dealing with active hyperthyroidism, you want to be careful about that because sauna will increase the resting heart rate. And if you already have an elevated resting heart rate, then you might not want to go into a sauna right away. But yeah, like I said, I haven't been perfect, but when I fall off the wagon, so if I'm on vacation, for example, I still try to eat somewhat healthy. But again, we're all human and I'm not perfect. But when I get back from vacation, I'm back to my regular routine. And some people, when they get off the routine, they stay on, they continue to indulge and eat whatever they're eating, refined food, sugars for weeks and months. And so, yeah, you definitely want to be strict most of the time, like eat well most of the time, not strict like AIP diet, but try to eat whole healthy foods most of the time. And yeah, so I mean, pretty much what I mentioned here is what I recommend to my hyperthyroid patients. So again, symptom management options I already spoke about. Really, it's up to the person. Uh, if they want to take the antithyroid medication, that's perfectly fine. If they aren't taking anything, then I definitely will recommend a natural treatment option if they like refuse to take the medication because of what they read and potential side effects. So yeah, I spoke about that, and then I spoke about potentially combining antithyroid medication with the natural agents. Again, the diet we spoke about. So getting back to iodine. So again, in the past, I've had actually a good experience with iodine and iodine supplementation. Again, in 2008, it was common for people to take high dose iodine when even when dealing with hyperthyroidism. Again, when you think about it, it might not make sense because what what iodine is important for thyroid hormone formation. So why would you want to take iodine when you deal with hyperthyroidism? And just to be clear, I don't take that approach these days. I'm very conservative with the iodine, so I don't tell my patients to do a urinary test for iodine and to take high dose iodine. There are still some practitioners that do that. Um, So I'm not super conservative with iodine, meaning I don't tell people to completely restrict it from their diet like some doctors do. I Everybody's different. Even if someone takes a multivitamin that has 100, 150 micrograms of iodine, most people could do okay. There are some foods like sea vegetables, especially kelp, very high in iodine. So usually I would recommend taking a break from those types of foods and maybe just trying to keep it below four, like not exceeding 400 or 500 micrograms per day, which isn't difficult to do if you're just eating food and taking even a multivitamin. If you're taking a separate iodine supplement, that's a different story, which again, I'm not recommending. Some practitioners will say to keep the iodine 200 micrograms or less. Like I said, I think it depends on the person, and you certainly could go with more of a low iodine diet if you want to. I have a book, one of my books, The Hyperthyroid Healing Diet. I talk a lot about iodine and low iodine. Talk a little bit about it in my other book, also Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, which is now it's in its third edition. But as far as food sources of iodine, the hyperthyroid healing diet goes into greater detail. And then, of course, other lifestyle factors, blocking out time for stress management. You're probably not going to completely eliminate the stresses from your life. So, just trying to block out the time to manage the stress is your best bet. Trying to get proper sleep, which I realize that it could be a challenge. If you have hyperthyroidism, you need to lower the thyroid hormone, or many people need to lower the thyroid hormone levels to get sufficient sleep. But there could be other factors like high cortisol, blood sugar imbalances, insulin resistance that could be causing sleep issues that we might need to address. I spoke about the testing I recommended. Again, it depends on the person. So it depends on the health history and depends on our conversations or an initial consultation. So I am more conservative. I don't think everybody needs to spend thousands of dollars worth of tests, but some people do need to do more comprehensive testing. So, like I said, it depends on the person. And then mention some of the general supplement recommendations like probiotics, omega-3 fatty acids, vitamin D, selenium, and then just other supplement recommendations depend on the test. And I also spoke about thyroid eye disease, just really, or briefly, I think I spoke about thyroid eye disease, not really the management of thyroid eye disease. Just remember, thyroid eye disease is also autoimmune. The same antibodies, those thyroid stimulating immunoglobulins that attack the TSH receptors, can also attack the tissues of the eyes. And as a result, that could cause the symptoms of thyroid eye disease. So, not to say there isn't a time and place for conventional treatment. I mean, even a time and place for surgery. And in 2020, a treatment came out called Tepezza, which, again, I've had a few patients take it, but there are risks, there are side effects like hearing loss and tinnitus. So it's really up to the person. Also, it's very expensive if someone doesn't have health insurance. But either way, you want to address the cause of the problem. You want to improve the health of the immune system, not only with Graves' disease, but with thyroid eye disease. And typically, with thyroid eye disease, the higher the thyroid stimulating immunoglobulins, the higher the risk of developing thyroid eye disease. So, again, not everybody has thyroid eye disease, but if you have very high thyroid stimulating immunoglobulins, then you are at greater risk. Doesn't mean you will develop thyroid eye disease, but you are at a greater risk. So that's pretty much all I wanted to chat about here. And, before wrapping up this video, I want to ask, when were you diagnosed with Graves' disease, and have you done anything to improve your health so far? I'm curious if you have changed your diet and lifestyle. Have you done any type of testing or taken any supplements? Please let me know in the comments below. And if you want to learn more about how to save your thyroid and regain your health, then I highly recommend to watch my free webinar entitled 5 Steps to Reverse Hyperthyroidism and Graves' Disease. And you can check this out by visiting savemythyroid.com/hyper webinar. And you can also find a link in the description below this video. Thank you so much for joining me today. Give this video a like if you learned something new, and consider subscribing if you want to learn more about how to save your thyroid.